Hi! So in this video, we're going to discuss the celiac trunk and its branches and how blood flows through them to supply some organs in the abdominal region with blood. These include the liver, the stomach, the spleen, and the pancreas. So, as you may know, the celiac trunk, along with the superior mesenteric artery and the inferior mesenteric artery, are branches arising from the abdominal aorta, which are going to supply different structures in the abdominal region. So the superior and inferior mesenteric arteries, they're going to supply the intestines, and I'm going to talk about them in another video that you can check out. But for this video, we're going to focus on the celiac trunk. So let's begin. So that's our abdominal aorta carrying blood, and here you can see the structure protruding straight out of the abdominal aorta, this blood vessel. This is our celiac trunk, this tiny little structure here. And the celiac trunk has three main branches: the common hepatic, the left gastric, and the splenic. So let's first begin by discussing the common hepatic artery and the branches that come off of it. So the common hepatic artery is, as its name suggests, it has the word hepatic in it, so it's probably going to supply the liver. So the common hepatic will become a proper hepatic artery, which will then divide into left and right hepatic arteries, and this will help supply the liver. Now, the common hepatic is also going to have another branch known as the gastroduodenal artery, which, as its name suggests, is going to supply the region near the duodenum. And this gastroduodenal artery, actually, it turns into this other artery known as, or rather it gives rise to another artery known as the right gastroomental artery, which is going to supply the greater curvature of the stomach, or the region near the greater curvature of the stomach, as you can see here. Now, let's go back to the hepatic artery for a second and just discuss one more branch of it. So the hepatic artery also gives rise to another branch along with the gastroduodenal artery and the proper hepatic artery, and this one is known as the right gastric artery. And as you can see here, the right gastric artery is going to supply the lesser curvature of the stomach. And now, so let's just think about this. If there's a right gastric artery, there's going to be a left gastric artery. And both these gastric arteries are going to help supply the lesser curvature of the stomach. So now let's move on to the next branch of the celiac trunk, which is actually just the left gastric artery. So yes, the left gastric artery is actually a direct branch from the celiac trunk, whereas the right gastric artery is actually arising from the hepatic artery, which is a branch of the celiac trunk. And these gastric arteries are going to supply the lesser curvature of the stomach. So now let's discuss the final remaining branch of the celiac trunk, which is the splenic branch, which is going to supply the spleen. And as it's doing so, it's also going to give out a few other branches. Oh, also, just to mention, I've denoted the splenic branch as a dashed line because to just show that it's going behind the stomach. So now, anyway, since we got that out of the way, the splenic branch, it actually gives out a few other branches, which include these tiny little short gastric arteries. And then it also is going to give out this other artery known as the left gastroomental artery, which, if you remember, the right gastroomental artery, along with that, it's going to supply the greater curvature of the stomach. So just so that this makes sense, the left gastroomental artery is coming from the splenic branch of the celiac trunk, whereas the right gastroomental artery is coming from a gastroduodenal artery, which is coming from a hepatic artery from the celiac trunk. And these gastroomental arteries are going to supply the greater curvature of the stomach, whereas we have right and left gastric arteries that are going to supply the lesser curvature of the stomach. So now our final remaining branch coming from the splenic artery is our pancreatic branches, which are going to help supply our pancreas. So now let's just have a quick recap. So as we can see, we have our abdominal aorta, which gives rise to our celiac trunk. The celiac trunk has three main branches: the common hepatic, the splenic, and the left gastric artery. The common hepatic artery is going to give rise to a proper hepatic artery, and then it'll turn into right and left hepatic arteries and supply the liver with blood. Now going back to the common hepatic, the common hepatic artery will also give rise to a gastroduodenal artery, which is going to supply the region near the duodenum. And this gastroduodenal artery will also give rise to the right gastroomental artery, which is going to supply the area near the greater curvature of the stomach. We then have another branch coming from the hepatic artery, which is known as the right gastric artery, which is going to supply the lesser curvature of the stomach. And along with that, we also have the left gastric artery, which, however, is a direct branch from the celiac trunk. Now, the final branch remaining for the celiac trunk is the splenic branch, which is going to, of course, supply the spleen. It also gives off some other branches, such as these tiny short gastric arteries, and also a left gastroomental artery, which is going to combine with our right gastroomental artery and together supply the greater curvature of the stomach. And the splenic branch also gives rise to some pancreatic arteries to supply the pancreas. So that's it for my explanation of the celiac trunk. I hope this video was helpful to understand this concept, and I'd like to thank you guys for watching, and good luck. Bye!